Hello and welcome to the PHA Public Health Assessment webinar, Data Screening Analysis of the ATSDR Public Health Assessment Webinars Training Series. This webinar explains the data screening analysis that needs to be conducted as part of the public health assessment, also known as the PHA process. It is based on Module 6 of the Online Public Health Assessment Training, also known as FAT. This webinar is sponsored by the Agency for Toxic Substances and Disease Registry. Please note that a 508 compliant PowerPoint presentation in PDF on the PHA webinar, Data Screening Analysis, is available for all learners to upload and read. This PowerPoint presentation will complement today's presentation. My name is Danielle Langman, and I will be your presenter for this webinar. I've been an environmental health scientist with ATSDR for about 27 years as a federal government employee. Before that, I did contract work for ATSDR for about 5 years. I've worked on many sites, from very small petition sites to very large refinery sites. During this webinar, you'll be learning about the screening analysis process, which will help you sort through sampling data and identify potential contaminants of concern that need to be evaluated more closely. In the overall context of the PHA process, you'll need to clearly understand what ATSDR comparison values, also known as CVs, and non-ATSDR screening levels represent and what they do not represent. This understanding will help you appropriately select screening levels and communicate the role that they play in our PHA process. This slide presents the webinar objectives. Today, we're going to learn about screening analysis steps. We're going to look at ATSDR CVs and non-ATSDR screening levels. I'll also outline the process for how to perform a screening analysis, even though ATSDR's Public Health Assessment Site Tool, or FAST, does most of the screening steps for you. As you proceed with the screening process, you'll eventually need to summarize your data in a document, such as a public health assessment. Although seemingly straightforward, this task can be quite challenging for sites that have large volumes of sampling data. Therefore, as a last step, I'll illustrate how I present screening results for several of my more complicated sites. As mentioned, today's presentation is based on FAT Module 6. We'll go over the screening analysis that involves using health-based ATSDR CVs and non-ATSDR screening levels. In general, screening levels ATSDR uses are derived from chemicals for which adequate toxicity data exist for each route of exposure of interest. Choosing these contaminants involves screening your site data and looking at and considering community health concerns. I've divided this webinar into 3 different sections. The first section, called Introduction to the Screening Analysis, we're going to look at ATSDR CVs and how we develop them, the different ATSDR CVs we use, and some of those non-ATSDR screening levels. In the second section, called Conducting the Screening Analysis, I'll go through each of the steps of our screening process and give an example from our Gallo-Lumba company site. In the third section, called My Site Examples, we'll walk through some screening process examples from my sites and how I presented the results in my health assessments. Now, I will introduce you to the screening analysis. It's basically only one small piece of our health assessment process, but it helps us work with unusually large data sets. During the screening analysis, health assessors follow a quick and systematic way to sort through data consistently to identify potential contaminants of concern that require further evaluation. These data sets contain environmental concentrations for contaminants sampled in a variety of media, such as air, water, and soil. When screening against our environmental screening levels, we generally begin with a list of chemicals found in both the potential and the completed exposure pathways. You then need to select the most appropriate screening level and the most appropriate chemical concentration to do your screen. A quick and easy first step is to compare the maximum detected contaminant concentration with the recommended ATSDR CV. But remember, this method is only used as an initial screen. You're not, at this point, incorporating site-specific exposure scenarios. The picture on the bottom of the slides is from one of my sites, Corpus Christi Refinery Row in Texas. Refinery Row is 15 miles of industries involving petroleum processing. There are literally millions of outdoor sampling data from 3 separate monitoring programs. As I'll illustrate later, the screening process helped me determine which of more than 150 chemicals detected in the outdoor air along Refinery Row required further evaluation. This slide shows how I consider the screening analysis process. The question we're trying to answer is whether we should evaluate the contaminant. This process can be thought of like a stoplight. Red indicates not likely a problem, stop. For those contaminants that were below our screening levels, we stop the process. We don't need to evaluate those contaminants any further. Yellow indicates there may be a problem. You should continue the pH process for those contaminants that are at and above our screening levels. Green indicates better chance of a problem, look into it now. This is when we might want to consider a health advisory to quickly address potential health risks for those chemicals that are well over screening levels by several orders of magnitude. ATSDR-derived screening levels are called comparison values and are also known as CVs. ATSDR CVs are concentrations of a chemical in a particular media, such as water, air, or soil, that are unlikely to cause harmful or adverse health effects in exposed people. CVs are set well below levels that are known or anticipated to result in harmful health effects. And they do help us assess large sets of data in a very efficient and consistent manner. CVs are media-specific concentrations for chronic, intermediate, and acute exposure durations. They are based on default exposure scenarios and do not reflect site-specific exposures. CVs are screening levels developed by ATSDR. If a contaminant concentration is below a CV, health effects are not likely. When a concentration is at or above a CV, we do need to take some further action or review. Remember though, for contaminants that are reported as non-detect at your site, if the detection limits for that specific contaminant are set above its recommended CV level, and there's the potential for that chemical to be at your site, non-detect might not equal 0. You might still need to do further action or review. This slide shows what ATSDR CVs are not. CVs are not cleanup levels. They should never be used to predict whether someone is going to have harmful health effects. They are not thresholds of toxicity, and they really shouldn't be used anywhere else in the public health assessment process besides during the screening analysis. So where do our CVs come from? Well, they're derived from ATSDR and Environmental Protection Agency, EPA, non-cancer health guideline values, and EPA cancer risk values. For non-cancer health effects, we have ATSDR's minimal risk level, or MRL. From EPA, we have the reference dose, or RFD, and the reference concentration, or RFC. To determine cancer risk, ATSDR does not have a cancer risk value, so we use EPA's oral cancer slope factor, the CSF, and inhalation unit risk, the IUR, to calculate a media-specific CV. Here's some information about ATSDR's non-cancer CVs used for screening. Again, it's important to know how and what conditions they were derived from so that you can understand their use in the PHA process. Our environmental media evaluation guides, or EMEGs, are calculated where adequate toxicity data exist. We can have CVs for 3 specified exposure periods: acute, intermediate, and chronic, but we might or might not have CVs for all 3 of these durations. Our EMEGs are based on ATSDR's minimal risk level, or RML, using conservative assumptions about exposure such as intake, exposure frequency and duration, and body weight. The default exposure assumptions account for variations in water and soil ingestion between adults and children, so our EMEGs are available for both adults and children. Note that the air EMEG for a contaminant is the same as MRL, and therefore no mathematical calculation is needed. We also use health guideline information from EPA to derive screening levels. Our reference dose media evaluation guides, or RMEGs, are available where EPA has determined that adequate toxicity data exist for chronic exposures. Our RMEGs are based on EPA's reference concentrations for inhalation and reference doses for ingestion. While RMEGs are only derived for the chronic duration, they are also available for child and adult exposures. Here's a graphic showing the derivation of our non-cancer CVs. We start with the non-cancer health guideline value. Because they incorporate lots of uncertainty or safety factors in them, they are set far below effect levels. We apply default protective exposure assumptions to the oral MRLs, and to the RFDs to derive ATSDR CVs. Note, for inhalation, we just use the MRL or the RFC directly because doses are not calculated for inhalation exposure. When developing these non-cancer CVs, ATSDR assumes the exposures occur through contact to a single medium and to a single contaminant for that specific period. And for non-cancer CVs, we're assuming only non-cancer health effects will occur. Now let's switch to ATSDR CVs used for screening cancer effects. ATSDR's Cancer Risk Evaluation Guide, or CREG, is derived for chronic durations. Again, they're based on EPA's oral, CSF, and IURs. These are based on 21 years of exposure during childhood, plus 57 years of exposure during adulthood. EPA derived these CSFs and IURs to measure the relative potency of various carcinogens. They are based on quantitative evaluation of exposure to suspected carcinogenic contaminants. They are estimates of increases in cancer cases in a human population. You can find out more about them on EPA's IRIS website at http://www.epa.gov/IRIS. Here is a graphic showing the derivation of ATSDR's cancer CVs, the CREGs. In developing our CREGs, like our cancer non-CVs, we're assuming that 1, exposure occurs through contact with a single medium. 2, exposure occurs to a single contaminant. And 3, exposure is only resulting, in this case, in cancer health effects. Again, we start by using the appropriate cancer risk values, which are EPA's CSF and IUR. The arrow pointing down shows that we apply a target risk level of 10 to the minus 6. This represents a possible risk of 1 excess cancer case in a population of 1 million people exposed over a lifetime. We do this calculation by dividing that target risk of 1 in a million by the contaminant's CSF or IUR. We do use default exposure assumptions for ingestion rates and body weights for the CSF. Of note, contaminants that cause cancer from a mutagenic mode of action can result in a higher risk of cancer for children exposed early in life than for adults. Calculation of cancer risk for mutagens require the use of age-dependent adjustment factors, or ADFs. Now will we talk about non-ATSDR screening values. In addition to ATSDR CVs, health assessors can use these non-ATSDR screening levels in certain circumstances. Many of these non-ATSDR screening levels are derived based on health effects observed in the scientific studies, just the way ATSDR CVs are. However, some are not completely health-based or are based on limited scientific studies. There are various types, such as EPA's regional screening levels, EPA's maximum contaminant levels or MCLs, and other federal and state agency values. When looking at these values, you need to understand how the non-ATSDR screening level was derived to ensure that it's appropriate for human health evaluation. For example, some states go into a very rigorous peer review process, while others might not. Historically, we have accepted EPA regional screening levels above other sources, but we still need to vet those screening levels to make sure that they are protective at our sites. If you're not sure if the value is appropriate, you should consult with a subject matter expert or an associate director of science, also known as an ADS. Examples of when you might use these non-ATSDR screening levels include when there's no ATSDR-derived CV available for a particular contaminant, when there's no ATSDR-derived CV available for a specific media, or if you have a site located in a state that has its own screening level. Again, you must review non-ATSDR screening levels. In some cases, when states have their own screening levels, we will use the ATSDR CV and the state screening level. As a health assessor, make sure you determine the basis of any non-ATSDR screening level and discuss that screening level in your document. So to summarize, non-ATSDR screening levels might be used if they lower, i.e. more health protective than ATSDR CVs, in addition to ATSDR CVs, or when ATSDR CVs are not available. In cases where a non-ATSDR screening level is adequately protective of public health and lower than ATSDR's recommended CV for the same exposure duration, health assessors can use the lower level after receiving approval by the ADS. In their document, health assessors need to discuss all the screening levels used for their evaluation. Now let's do a knowledge check. Knowledge check 1. I'd like you to think about all of the options you would select as being true about ATSDR CVs. The possible options are A, are based on both cancer and non-cancer effects. B, are thresholds of toxicity. C, assume exposures occur to a single medium. D, assume exposures occur to a single contaminant. And E, are not media-specific concentrations. Please take a few minutes and select all that apply. So, how did you do? As shown with the green check marks, those who selected A, C, and D had the correct answers. Good job. Our CVs are based on cancer and non-cancer effects. They do assume exposure occurs to a single medium, and they do assume exposure occurs to a single contaminant. As shown by the red X's, B and E are not the correct answers. Note that CVs are not thresholds of toxicity. Again, we don't use them to determine whether there will be adverse health effects at a site. Answer E is not correct because CVs are media-specific concentrations. Now let's move on to knowledge check 2. Looking at this question, think about everything that is true about non-ATSDR screening levels. The possible options are A, can be used when no ATSDR-derived CV is available. B, do not need to review the derivation. C, are based solely on health effects. And D, include EPA regional screening levels or RSLs. Please take a moment to select all of the true options. Well, those who picked A and D as shown by the green check marks are correct. Good job. Non-ATSDR screening levels can be used when there is no ATSDR-derived CV, as long as it's appropriate. And they do include EPA regional screening levels. As shown with the red X's, answers B and C are incorrect. You do need to review the derivation. And again, non-ATSDR screening levels are not all based solely on health effects. For example, our FAST CV module provides EPA's maximum contaminant levels, or MCLs, and they're based on health effects and treatment technology. Not all non-ATSDR screening levels are only based on health, and you need to be aware of that. Good job, everybody. Now we're in the second section of this webinar, which is conducting the screening analysis. There are 5 steps in our screening analysis process. The first of those steps is to review site information and available sampling data, which you covered in Module 5 of FAT. The second step is to identify all contaminants and corresponding maximum concentrations for screening. The third step is to identify appropriate ATSDR CVs and/or non-ATSDR screening levels. The fourth step is to conduct the actual comparison and identify contaminants that require further evaluation based on screening. Again, FAST, ATSDR's Public Health Assessment Site tool, does this for you. And lastly, we need to check if there are any site or contaminant-specific factors that might warrant further evaluation, and this includes community concerns. We want to make sure to consider community concerns during the screening analysis. For instance, what about methyl ethyl terrible? Well, if the community is concerned about methyl ethyl terrible, even if it wasn't detected, or if it was detected below our screening levels, you should select the contaminant and include it in your report, because we're here to address community concerns about chemical exposure. And if the exposure didn't occur or occurred below a level of health concern, it would be important to make sure that we discuss that in our document. Now we'll go over each of the steps and decisions for screening that help us identify chemicals whose concentrations are below screening levels and likely pose no hazards. Those steps and decisions will also help us identify contaminants and concentrations that meet or exceed screening levels and may require further evaluation. This graphic will walk us through the steps. The first red highlighted box is step 1, reviewing site information, which, again, you covered in FAT Module 5. Module 5 helped you define which sampling data were appropriate, identify factors that affect data quality, and helped you select all of the sampling data that were appropriate to use in the PHA process. Here is the second step, located in the middle top right red highlighted box. Once you've selected the sampling data that are appropriate for you to use in the PHA process, you need to identify contaminant concentrations for screening. In general, you will identify and use the maximum concentration for each contaminant in each medium. However, for some air screening evaluations, you may need to use something other than the maximum that fits your site-specific conditions and contaminants. For instance, it might be appropriate to average your air data over a specific period, to use peak levels, or to use some other statistical variation. In these cases, you should contact a subject matter expert or an ADS for more information to make sure that you're following the process correctly. In the third step, which is highlighted in red, you'll look for screening levels that are specific to each contaminant in each medium in your data set. You'll ask the question, are appropriate media-specific screening levels available for our contaminant? If the answer is no, that is, if you don't have appropriate screening levels for the contaminant, you'll proceed to the right on this figure and retain that contaminant for further evaluation, which is covered in Module 7. Note that if there is no ATSDR CV, you can check to see if there are non-ATSDR screening levels. If the answer to the question, are appropriate media-specific screening levels available for a contaminant, is yes, you do have screening levels, you proceed down to the next box in the figure. Remember to always use an ATSDR CV if one is available. You should select the CV for screening recommended by FAST, the Public Health Assessment Site Tool. This is usually the CREG or chronic EMAG. If only acute CVs are available, you should retain the contaminant for further evaluation. If you chose yes in the previous step, indicating that inappropriate media-specific screening levels were available for your contaminants, you move on to this next red highlighted box. During this fourth step, you screen to check if the appropriate concentration selected meets or exceeds your screening levels. If yes, you proceed to the right on this figure and retain the contaminant for further evaluation. If no, you proceed down the figure to the next box. If you chose no in the previous step, then you will consider whether there's anything else that might make you say, I should retain this contaminant for further evaluation. This can include if the chemical was of concern to the community. It also includes if the detection limits exceeded the lowest CV and the chemical might occur at your site. Remember, not detect does not necessarily equal 0. Here are some tips for when you're conducting the screening analysis. Note that data might be presented in different units, such as these for water and soil. Make sure that your site data are in the same units as the ATSDR CVs and non-ATSDR screening levels that you're screening with. If you're using FAST, the system converts the concentrations for you. For example, if you put your water data in as parts per million, FAST will convert the units to parts per billion because those are the default units FAST uses in its water CV screening module. Also note that contaminants might be known by several names. For example, tetrachloroethylene is also known as tetrachloroethene, ethylene tetrachloride, PCE, 1122 tetrachloroethene, 1122 perchloroethylene, 1122 tetrachloroethylene, perchloroethylene, and perc. Even though these names might not be the same, they're actually all the same contaminant. So if you can't find a CV for one of your contaminants, make sure that you look for synonyms. Note that FAST provides a list of common names for you. When you select a contaminant name from FAST's drop-down list, make sure it matches the contaminant in your data set. Lots of contaminant names can look similar. You can also use Chemical Abstract Service Registry Number or CAS number to help you with this. Note, again, the chemical names can look similar, like tetrachloroethene and tetrachloroethane. If you're only looking at the main chemical, they look the same, but one ends in ethane and the other ends in ethene. Next, 1112 tetrachloroethane is not the same as 1122 tetrachloroethane because the congeners, or the number at the beginning of the contaminant name, are not the same. For 1,2-tribromobenzene and 1,2,4-trichlorobenzene, the congeners 1, 2, and 4 are correct. But 1,2,4-tribromobenzene and 1,2,4-trichlorobenzene are not the same chemical. When entering complex names that include numbers or cis and trans, it's often better to use the Chemical Abstract Services Registry Number, or the CASRN. This will avoid any confusion about chemical names. Good sources for the CASRN include ChemID Plus and the National Library of Medicine PubChem. Let's talk about some additional things to consider when doing your screening analysis. When you conduct the screening analysis, you might have several CVs that are available. Always use the FAST recommended CV, which is usually the lowest CV, but not always. If only acute or pica CVs are available, retain your contaminant for further evaluation. regardless of whether they exceed those extreme CVs. Again, if there is no CV, you are not required to look for another screening level. You can simply carry that contaminant into your assessment as a chemical of concern. Sometimes, when there are no CVs or non-ATSDR screening levels, there are exceptions where the chemical is not carried any further in the assessment. For example, essential nutrients such as calcium, iron, and magnesium are typically not harmful under most environmental exposure scenarios, and you may not want to contain them for further analysis. Also note that there are several chemicals that warrant special consideration, including asbestos, lead, and radionuclides. You can find guidance on these, as well as individual contaminants within groups of polychlorinated biphenyls, or PCBs, and dioxins and furans in the resources section of FAGM, the Public Health Assessment Guidance Manual. If you have chemicals like these, you should consult with a subject matter expert during the screening process. Also note that if you have more than one PFAS compound in your sampling data, you should talk to the ADS office for assistance in evaluating and screening for mixtures. Now I'd like to go on to the next knowledge check. The knowledge check number question 3 is, which is not a step in the screening process? The options are A, retaining contaminants for further evaluation, B, identifying media-specific CVs for contaminants, D, determining the potential for harmful effects, and D, eliminating contaminants from further evaluation. So which answer would you choose? As indicated by the green check mark, choice C is correct. Determining the potential for harmful health effects is not a part of the screening process. The red X's indicate that answers A, B, and D are incorrect. Choice A, retaining contaminants for further evaluation, is one of the primary steps of screening. Choices B and D, identifying media-specific CVs for contaminants and eliminating contaminants from further evaluation, are also steps in our screening process. Okay, let's move on to knowledge check number 4. The question is, please select all that are true about ATSDR screening process. The choices are A, retain contaminants when only acute CVs are available, B, always look for non-ATSDR screening levels, C, consider contaminants of concern to the community, and D, use fast recommended CVs. Please think about all the options that are true. For those who chose A, C, and D, great job. As indicated by the green check marks, these are all true answers about our screening process. For choice A, we should retain contaminants when only acute CVs are available. In fact, we should retain contaminants when only CVs are available, regardless of whether your contaminant exceeds the CV. We always consider contaminants of concern to the community, which is choice C. And we should always use fast recommended CVs, which is answer D. As I indicated previously, you are not required to look for non-ATSDR screening levels. If we don't have a screening level for a contaminant, you could just move that chemical into the category of, I'm going to take a closer look and further evaluate it. This is why answer B is incorrect, as indicated by the X. In summary, for conducting the screening analysis, we select chemicals of concern if the concentrations are at or exceed a CV, if there's no CV, if its detection limit exceeds the CV and it might occur at the site, or if there's community concern. Now let's do a simple exercise for our Gala Lumber Company site. Again, for those you who took the first 3 webinars, you know that it was a wood treatment facility from 1974 to 2002 that use chromiated copper arsenate, or CCA, to preserve its wood products. The CCA contained arsenic, chromium-6, and copper. They placed the treated wood on uncovered drip pads, and as the wood dried, the CCA contaminated drippings went directly onto the ground. Then, in 2005, Sunshine Play Care Center opened and began operating right next to the former drip pad area. In December of 2015, EPA collected surface soil to determine if any CCA components were present around the daycare. As shown in the figure, they collected 18 soil samples. This is the data table presenting the surface soil results for arsenic. I'm only choosing arsenic to simplify our example. What do we do to screen these data? First, we follow our decision logic and our 5-step screening process, and we start with step 1. For step 1, we review the data and the site conditions. In the last module, you completed this first step. You evaluated the representativeness of these data, and you found a few issues. For example, your data didn't provide the sampling depth. Soil less than 3 inches is considered surface soil by ATSDR and would be preferred for us to evaluate at a daycare where children play. For this example, though, let's assume you did further research and learned that the samples were in fact found within 3 inches of the surface. Let's also consider that these samples are representative. During our data gathering, we also note that 1 or 2 children at the facility might have engaged in pica behavior, and that children may access all portions of the daycare facility. So our data are representative of 1 exposure unit. Now moving on to our second step, we identify contaminants and corresponding maximum concentrations for screening. Again, for this practice, we're focusing on only arsenic data in surface soil. The row in the table that is highlighted with the red box around it indicates that the maximum detected level was 1,020 parts per million from sample SS-GL-DC-14. For step 3, we can identify the appropriate ATSDR CVs by using the CVs and Health Guidelines module in FAST. This slide presents the FAST recommended CVs for screening our soil data. Note the flag for arsenic, indicating the health assessor should use the chronic child EMAG of 16 parts per million for screening purposes, which is the same as the chronic child RMAG, rather than using the lower Cancer Risk Evaluation Guide, or CREG, of 0.26 parts per million. The CREG for arsenic is below background levels. Therefore, ATSDR's recommended soil CV for arsenic is the chronic child EMAG or RMAG, because both are the same value. For step 4, as I said previously, FAST does all the screening work for us. The top red highlighted box on this slide shows the results of screening the maximum concentration of 1,020 parts per million in our FAST application. The inside of the highlighted box shows that FAST provides a summary for all available CVs. Most important, though, is that FAST gives you the recommended CV. In our case, the maximum concentration exceeds the recommended chronic child RMAG and EMAG, as indicated with the red shaded cells in the table. The maximum arsenic value also exceeds additional CVs, as indicated by the yellow shaded cells in the table, including the CREG, the chronic EMAG for adults, the RMAG for adults, and the acute pica child EMAG. FAST will also allow you to download your site table into a table like this. As shown on the slide, the chronic child EMAG and RMAG is the recommended CV, and FAST will tell you to select arsenic for further evaluation. If you had more contaminants, this list would be longer and would include their maximum concentrations, their ATSDR recommended CVs, and whether they would be selected for further evaluation. For Gallalumba Company, arsenic in soil at our daycare will be considered for further evaluated in FAT Module 7 and covered in the PHA webinars, exposure calculations, and toxicological evaluation. In this third and last section of the webinar, I'm going to cover a few examples from two of my sites. I will show you ways that I presented descriptive statistics and screening results. I will also show you the process to perform an initial and a refined screening. These examples are a little bit more complicated than the Gallalumba Company practice site. Note, however, these are only examples of my sites, and I work with the ADS and subject matter experts because I went beyond the initial screening steps presented thus far in this presentation. You should use FAST. It is the recommended screening tool, and it really does all the work for you. For my examples, I looked at soil involving hundreds of properties and outdoor air involving millions of samples. The first site I'll cover is in terms of descriptive statistics using a table and a figure. It was for my soil example site, which is shown in these pictures. Residents of Superior, Montana had expressed concern regarding exposure to waste tailings from the Flat Creek Iron Mountain Mine and Mill site located in the town of Superior, Montana. In the past, the waste tailings were actually taken from the mine site into the town and used as surface fill on public and private residential properties throughout Superior. Contaminated areas included driveways, yards, gardens, playgrounds, public rights-of-ways, schools, and public areas such as fairgrounds. In January of 2010, we did a health assessment and found that the levels of arsenic and lead in some of those town properties could harm people's health. The left picture shows a sign stating that the soils and water in the area could pose a risk to human health. The mine itself actually had a lot of brown runoff, shown in the far right picture. And the middle bottom picture shows the mine tailings that are still on the site in these huge piles. ATSDR recommended additional characterization of the soil. The arsenic results that I'm presenting in this table are from that additional soil sampling conducted by EPA, based on our public health assessment recommendations. This table provides descriptive statistics, including screening with the arsenic EMEG, as we did for the Gallalumba Company site. I am not using the Craig, even though it's lower than the EMEG, to screen my data. For this site, arsenic results were available from 1,028 samples and from 192 different residential and non-residential properties. In addition, we were evaluating past, current, and future exposure scenarios separately for each of these properties. I used this table in the main text to provide results so that we could get an overall feel for where the data stood regarding screening. These values were also used in the toxicological evaluation section of my document. The complete data set for each scenario for each property was provided in an appendix because each of these properties was considered its own individual exposure unit. I found that providing tables like this one and giving an overall understanding of the screening data when you have hundreds of exposure units is a nice way to show what's going on in the community-wide. The statistics, such as the minimum, the maximum, and the mean, can show people how often data go above our CVs. These data show that in the past, 72 residential properties and 28 non-residential properties were at or above our arsenic EMEG for this site community-wide. But for the future scenario, only 36 residential and 17 non-residential properties were expected to be at or above the arsenic EMEG. This box plot is another way to present some of the same arsenic data. The box plot provides this visual of the properties that exceeded the arsenic EMEG. Box plots are basically a standardized way of displaying the distribution of the data. The circles on my plot are the outliers. The graph shows the arsenic concentrations for past, current, and future scenarios. Concentrations shown in dark purple for the residential properties and in the lighter purple for the non-residential properties. The line across the scenarios shows the arsenic EMAG. From the past scenario on the left, the dark purple residential box indicates that a large portion of the data are below our arsenic EMAG. Then the lighter purple non-residential box indicates for the past scenario that most non-residential properties, including the fairgrounds and schools, went above our arsenic EMAG. For the future scenario, on the right side of our box plot, both of the types of property are mostly below our arsenic EMAG, with only the outliers above. People like having different options. I personally like providing tables and graphs. As an engineer, I like the tables, but I think that the communities understand the distribution of the data better with a visual such as a box plot. As another example of my site work, I had to use a two-tier screening process to help me determine which of more than 150 chemicals that were detected in outdoor air along 15 miles of refineries required further evaluation. I had millions of outdoor sampling data points throughout the entire region from 3 different monitoring programs. As this figure illustrates, the screening process for the first step was gathering the data on the chemicals. The initial screening step was to determine whether our maximum chemical levels were at or exceeded the lowest relevant health-based CVs. As I went through the initial screen, I only had a modest number of chemicals drop out. After the initial screen, there were too many chemicals to evaluate, so I added a refined screening step to determine whether the maximum chemical levels were at or exceeded short-term CVs and whether the mean levels exceeded long-term CVs. And that brought the number of contaminants I was evaluating at the site to a more manageable number. For this site, I had more than 55 tables in an appendix that presented the results of both the initial and refined screening process. This slide represents a very small snapshot of our automated gas chromatograph, or AutoGC, screening data. AutoGC data were from 2005 through 2010 and included a sample collected every hour of every day all year. Now remember, for initial screening, I compared the maximum chemical level to the lowest recommended CV, which is the screening process that I've described in this webinar. On the top, note that the red outline above around 1,3-butadiene with a maximum level of 35.7 parts per billion. The location was in Solar Estates, which is at the west end of Refinery Row, and had a date of 2009. On the bottom, I provided the ATSDR 1,3-butadiene CVs from FAST. The available CVs are for the Craig and RMEG. Now question, in looking at this slide, would you screen 1,3-butadiene into your evaluation based on those initial screening results? Let's find out how you did. For initial screening at this site, the answer is yes. Remember, we defined initial screening at this site to say that we were going to compare the maximum level to the lowest CV, and the maximum level of 1,3-butadiene exceeded the ATSDR recommended CV, the Craig, and the other CV, the RMEG. For the same 1,3-butadiene example, here are the results from FAST presented for refined screening. As we move from left to right across the table, I first provided the location, then I provided the total number of samples. Again, because these were AutoGC data taken every hour, we have over 40,000 samples. Next, I provided the number and the percent of the samples that were above the detection limit. Because our detection rate exceeds 20%, I was able to calculate and provide mean levels, lower confidence levels, and upper confidence levels on my data set. Now another question. Based on these data, would you screen 1,3-butadiene into your evaluation based on my refined screening results? The answer is yes. Remember, for my refined screen, I screened maximum levels against short-term CVs and the mean levels against long-term CVs. The bottom table from FAST shows that there is no acute EMEG. Therefore, I did look at 1,3-butadiene for short-term exposures at this site. For long-term exposures, the means, upper confidence limits or UCLs, and lower confidence limits or LCLs were all above our Craig CV. Therefore, I did screen 1,3-butadiene into my long-term evaluation for this site too. This is tetrachloroethylene, another chemical at the same site. In this case, it was a 24-hour canister sampling data collected by the Texas Commission on Environmental Quality every third or sixth day, depending on the location. When I looked at the initial screening data for tetrachloroethylene, I compared my maximum level of 1.88 parts per billion to the lowest CV, which in this case is 0.57 parts per billion. Based on initial screening, I screened tetrachloroethylene into my evaluation, even though none of the other CVs for tetrachloroethylene were exceeded. However, when I looked at the data to do my refined screening, I found that tetrachloroethylene was very rarely detected at the station with that maximum concentration, which was Hillcrest. As the table shows, I cannot calculate a mean value because the detection rate was only 8.9%, which is lower than the 20% detected rate that is needed to calculate a mean, LCL, and UCL. At Navigation and Poth Lane, we had 32% and 24% of the samples above the detection limit, so we were able to calculate means, LCLs, and UCLs. But as you note, even the UCL values of 0.026 parts per billion for navigation and 0.015 parts per billion for Poth Lane were below our Craig value. Even though I screened tetrachloroethylene into my evaluation to begin with, I did not keep it in my evaluation and did not consider it further after refined screening. This was a table in the main part of my health assessment document. It showed the community what chemicals I was going to look at and why. My 150 plus chemicals were shortened to this list of chemicals, which is still a lot. But I do provide lists for those contaminants where the maximum levels were at or above their short-term CVs in the first column, where the mean levels were at or above long-term CVs in the second column, where no short-term CVs were available, and where no long-term CVs were available. You may have noticed that some of these contaminants are repeated. This is for chemicals that we looked at in terms of their short-term exposures and their long-term exposures, such as barium and benzene, highlighted in red in this table. For the same Corpus Christi Refinery Row site, we displayed the data in a lot of different ways. The toxicological evaluation data were displayed differently than the screening evaluation data. But this is one of our screening evaluation graphs. The figure shows benzene concentrations at 3 of the auto GCs, and note that you have a lot of concentrations at Weisach, Oak Park, and Solar Estates. The top figure, which shows you our acute EMEG, is in linear scale. In the bottom figure, we were able to show the acute EMEG and the Craig, and that is in log 10 scale. The dashed line indicates the acute EMEG, and the very dotted line indicates the Craig. Now I'll explain what this figure tells our community and how it can help explain our screening process. Well, from the top figure, which is the linear scale, this red highlighted oval on the top left shows that at the Weisach Auto GC station had the highest levels of benzene, and it also exceeded the acute EMEG quite a bit of the time. Note that the top right figure at Solar Estates, which is on the opposite end of Refinery Row, there are more exceedances, but still not quite as much as Weisach in terms of our acute EMEG. The bottom figure, which is in log 10 scale, shows that all 3 monitors regularly exceeded their CREGs. In summary, health assessors should ensure that they are using the most appropriate and up-to-date CVs, and if needed, non-ATSDR screening levels. ATSDR and other entities regularly update their screening levels. If you use the FAST application, you automatically get the most up-to-date ATSDR CVs, so I highly suggest that you use FAST. We should select a contaminant as a chemical of concern if its concentration is at or exceeds an appropriate health-based ATSDR CV or non-ATSDR screening level, if there's no health-based ATSDR CV or non-ATSDR screening level, if its detection limit exceeds the ATSDR or non-ATSDR screening level, and it may occur at the site, or if there's a lot of community concern about the chemical. And that's the end of my presentation for this PHA webinar, Data Screening Analysis. Thank you for listening.